Hello everyone and welcome to our special topic presentation on DICOM file de-identification using mapping approach for metadata and OCR for image anonymization. With the growth of digital medical technology, hospitals and clinics create a lot of digital images like X-rays and MRIs that help doctors understand patients' health. These images are saved in a spatial format called DICOM, which not only stores the picture but also information about patients like their name, birth date, and ID number. While sharing these images is important for helping doctors to work together for medical research, it also raises privacy concerns. This is because these images contain personal details about the patients. To protect privacy, this information needs to be removed or de-identified so that the patient's identity is hidden. Recent studies conducted by researchers available on the NCBI PubMed Central platform show how data breaches are concerned in the medical industry, showing of up to around 75% of data breaches from 2005 all the way up to 2019. This is why laws like HIPAA set rules for keeping health information private. However, removing patient information from DICOM file is tricky, because personal details might not just be in the main data or metadata, but also hidden in other parts of the images like text or labels. The challenge is to find all the information, remove it consistently, and follow privacy rules carefully. This way, the files can still be useful for research or diagnosis, but without putting anyone's personal information at risk. Our model workflow begins with the intake of DICOM files as input. We then anonymize the metadata and visual data within each DICOM file separately. After completing this two anonymization process, we merge the anonymized metadata and visual data into a single DICOM file. Our metadata anonymization process removes all PII from the DICOM files while retaining clinically relevant details. Tags are categorized by sensitivity, essential tags are kept, and direct identifiers like names, IDs, and dates are anonymized. We use synthetic replacement to ensure consistency across records, hashing for reversible identifiers like UID, and consistent date shifting to maintain event squares sequences without revealing actual dates. Additionally, we generate CSV files that store mappings of original identifiers to anonymized one. We use Tesseract OCR and Microsoft Presidio to strip out any personally identifiable information in the DICOM image. It first uses the Tesseract OCR to scan the image for any text that might be embedded, like patient names, IDs, or dates. It converts that text into digital text which can be analyzed further. Then we use Presidio to identify which of them are PII. And then we apply methods of pixelization, blackout bars, and text overlays to remove obscure PII and such that the underlying medical images remain clear for the diagnostic purposes. We conclude by manually reviewing the sample of the image to ensure that all PII has been removed and the image diagnostic quality is still maintained. Our model can be categorized into three parts: anonymized images, de-identified metadata, and mapping files. We modify the DICOM metadata in accordance with key metrics, following with best practices. This includes actions such as shifting dates, removing accession number and physician's name, changing the patient's ID, and retaining or modifying other tags as necessary, depending on the specific requirement of the identification. In the results of our image anonymization, we demonstrate how our methods effectively eliminate visible personal information from the DICOM image, as shown in the before and after comparisons. Our model successfully removes the patient name, date of birth, and content date by filling the text-containing area with colored block pixels. We also provide the mapping for patient ID and unique identifier or UID, which allows authorized authorities to researchers to trace back to the original patient's information if necessary while still maintaining complete privacy. To assess the effectiveness of our de-identification models, we verify output against the answer key that follows TCI de-identification standards. Actions are categorized into three main categories: DICOM compliance, HIPAA compliance, and TCI-based best practices. Moreover, the scores will be determined as a percentage of successfully completed actions against the total required actions in the table. For the final submission, our model received a score of 99.55% accuracy, with only 1,902 incorrect output out of roughly 422,000 total entries. Details of the failed and passed actions are provided in the table, which can help identify areas for further refinement and optimization. For future work, we aim to enhance the de-identification by implementing thresholding and improve text recognition, applying semi-supervised methods for smarter metadata anonymization, and incorporating advanced error detection to flag issues early. That's all for our presentation today. Thank you very much for listening.